Insights from the world's best medical minds. You are watching TheRightDoctors.com.
Hello everyone, you are watching Dr. Inusha from Department of Pediatrics, PGI Chandigarh. So here we are speaking about what the COVID-19 pandemic has done, how the children are suffering. So people think that children are not susceptible to this virus, and only adults are susceptible, but that is not the case. Actually, adults are susceptible and children are also susceptible, so everyone is vulnerable, but the immunity of the children is better, so they tend to respond better, and they tend to recover early compared to the adults, especially those above 50 years of age. So if there are comorbid problems, be it adults or children, they are likely to have more severe disease. And regarding immunity of the children is better because the immunity is some immunity comes from the mother, then the immunity improves with growing children, and then after a certain age, the immunity comes down. So there is a fall in the immunity, or the susceptibility increases, may it be to infections or cancers. So both inflammation and malignancy, they have similar pathophysiological mechanisms. So so children are also susceptible, adults are also susceptible, but adults respond to the disease better, and the children respond better compared to the adults, and the adults who are up to like 30 years or 25 years, they also respond well. But if the adults are more aged, more than 50 or 55 years of age, that may the cutoff may vary from country to country. So their susceptibility may be higher, and they tend to have more severe disease, and there is increased chances of severe morbidity or mortality. So how do we protect our children so that they don't get infected, or they don't transmit the disease to others? So especially if children are there along with older people in the house, so precautions have to be taken, and it is better to avoid going out unless it is necessary, and the children should be taught how to clean their hands and how to maintain social distancing, and when they, especially when they are in a group when other people are around. So if that is done properly, and so everyone can be protected, and it is also important to wear mask when someone goes out to the market, or to get some minor home material. So one should be protected with unlock having started. So if these people are not careful regarding these precautions, then there is more chance of spreading of the infection, and so increasing the fatality also. And there is another concern, that is about Kawasaki disease. Why Kawasaki disease is increasing with the coming of this COVID-19 infection? The Kawasaki disease is also because of an inflammatory response to an infection. So in Kawasaki disease, what happens is there is a cytokine storm, or there is aggravated immune response to an infection, because of which there are some problems, and there is also lymphadenopathy, there is redness of the lips, and there is peeling of the skin, and so these things occur when there is a higher or heightened immune response. So that is why IVIG is given to decrease this immune response in Kawasaki disease, and multiple doses of IVIG have to be given to combat this. And if it is due to COVID-19 infection, if it is precipitated due to COVID-19 infection, then the other treatment that is being followed as per the guidelines, that should also be given in the therapy, like hydroxychloroquine or remdesivir or plasma therapy, whichever is available and feasible in that setting, that should be given. And so if we follow the proper guidelines, then we can protect ourselves, and also we can protect those around us, and we can also avoid the overload on the hospitals, because if more number of people get infected, more number will need ventilators. And people now also we are seeing somewhere people are running from hospital to hospital, and there is problem in getting a ventilator. So it is better to follow the guidelines, and so that everyone is protected against this COVID-19 virus, and we can help in flattening the curve of this pandemic, be it in the country or across the world. So unless everyone is careful, unless everyone contributes to this, so we cannot achieve our goal. So everyone has to work together. They may be hospital staff, they may be the general population, they may be the sanitary staff. Everyone should be careful and should take proper precautions. The another concern is regarding children is when the schools will open, and when the children can go to school, and when the classes will start. So once the curve flattens and the infection risk comes down, then one can open these schools, and children can go to their school, and the parents can also be satisfied or not scared of sending their children to the school. So now most of these schools are having online classes, because physical presence for classes is not feasible in a present scenario. Then in children, what is the role of BCG? That is, everyone asks, what is the role of BCG? Does BCG actually protect against the virus? So it may be that BCG has some immunological effect, some protective effect, but it is not that if one has taken BCG, one can roam freely and nothing will happen to that person. So, and that too, that effect of BCG will not be till you say like 40 years of age, or 50 years of age, or 60 years of age. Maybe some protection from BCG will be there in the younger children or adolescents who have taken BCG in their early infancy. Because that is because BCG, some vaccines act through the cell mediated immunity, and some through the humoral immunity. And this cell mediated immunity, this in acts in case of BCG, and there is some probably cross similar pathophysiological mechanism working when this COVID-19 infection occurs. So because of that, some coincidental or some overlapping immune phenomena, maybe BCG has some degree of protection. So it is said that those countries where BCG has been given or is being given regularly to the children, they have less chances of getting the infection, or the infection rate or the fatality rate may be lower in those countries. The another thing which is circulating is the which strain of the virus is lethal and which strain is um, less lethal or better. So we should not be fooled by all these gossip, because the strains actually go on changing, and it is difficult to predict which strain is coming and which strain is going, which new strain is coming, unless we test frequently. And it is not that if one strain is lethal, the other strain will not cause mortality. So with both the strains, mortality can occur. If the body's immune response is less, then severe infection can occur, and the mortality can occur. So in this context, it is said that you should boost your immune response so that you can fight the COVID-19 virus better. So for this, people say you should take adequate rest, you should avoid stress, you do meditation, you do yoga, you take some traditional Ayurvedic preparations to boost your immunity. All these are just to increase your immunity, so that you are not susceptible to the infection, or even if the infection occurs, then you can fight it properly. So everyone should be careful, follow the guidelines, and if we do it right, if everyone does it right, then we can fight this virus, we can get rid of this virus early. Otherwise it will be difficult to control the virus, because we are almost fighting against an invisible enemy. So if you know what is happening, you can see what is happening, then accordingly you can protect yourself. But in this situation, it is that we cannot see what is happening or what is not happening. So anywhere, maybe in the house, or in maybe the hospital, or in the market, anywhere you go, if someone is infected, then you are also susceptible to that infection. So one should follow the social distancing, one should follow the proper personal hygiene, and keep away from any big gathering, and only those who are going to office, they should go to the um, uh, office, and try to come back early, so that exposure can be reduced. So even in schools, the teachers should also tell the children during that online classes that you should take all the precautions regarding prevention of this infection, or fighting this infection. So we know many things about COVID-19. We don't know many things. Basically, it is a RNA virus, and it is causing pneumonia, and it is that it is also causing thromboembolic phenomena. And it is said that many of times this thromboembolic phenomena may be the cause of death. So my thrombi or microemboli in the pulmonary circulation, or in the cardiac circulation, or in the CNS, they may be the cause of complications, and they may lead to mortality in these patients. So there is a research going on the vaccines, on the clinical trials for these vaccines. Different vaccines are being tried for COVID-19, but no one knows when actually the vaccine will come into use. There are just speculations that by September or by December we'll be getting this vaccine, and then everyone can take that vaccine, and everyone can be protected. But who knows how much the vaccine will be effective, or how much the vaccine will not be effective. So every time, prevention is in any situation, prevention is better than cure. So if we can prevent something, then maybe it is an infection or a cancer or whatever. If we can prevent, then it is better than finding cure or finding treatment for that particular infection or cancer. So everyone has to be careful, and especially the older members in the family, they should keep a distance, should not go out. So they should remain isolated, and the children should also be taught how to take the precautions. And especially if there is a child also who is less than 1 year of age, then that child should also be protected, because when the child is less than 1 year of age, that child's immunity may not be properly developed to fight any sort of infection. So severe infections mostly occur when the child is less than 1 year of age, or there is a age factor. So if the person becomes older than 60 years of age, then maybe the susceptibility is higher, or the response will not be that appropriate, and so there will be chance of severe having a severe infection, or there may be a requirement of more aggressive therapy for that sort of infection or cancer. So So now we have covered how COVID-19 is occurs in children, and what is the relationship with is there with Kawasaki disease. Then how we can protect our children, how we can protect the older people, and regarding the vaccine which is supposed to come. And then another thing is that this COVID-19 infection has changed the way the people used to look at the world, or people used to look at each other, or the people behaved with each other, the relationship. Everyone wants to maintain a distance, and everyone has to follow these social distancing guidelines, and many chats are done online, or classes are being done online, even for schools, for colleges. So this is a change which is coming in the world, and maybe this change is going to stay for a longer time, because we don't know when we will be getting rid of this COVID-19 infection. And so everyone has to be careful, and everyone should follow the national guidelines, and so we can be protected, we can protect those around us, and we have also a responsibility for the future, and we should take care that everyone's future is protected. Like it should not happen that some people have lost their jobs, they don't get like a proper feed or proper diet, and that causes again increased mortality, and this contributes to the problem in economy. And so everyone has to work, but work with proper precautions. And so that is all that I have to say. So now we have discussed so much about the children. So I think many of your everyone's queries have been answered. And if any more queries are there, then I will be glad to respond on email, or later sometime in some other session. Okay. Thank you. Thank you for listening.
Insights from the world's best medical minds. You are watching TheRightDoctors.com.